next company is Mira. Mira is a one-stop shop for preventative urgent care and lab tests with a predictable $99 fixed copay. I'll turn it over to Khang to tell you a little bit more about Mira.
My name is Khang, and I'm the founder and CEO of Mira. And arguably, we're solving the biggest problem in America today, which is to lower healthcare costs. And we're doing so by building the nextcare.com, starting with preventative and urgent care. I'm also very happy to be back here today because just a few years ago, I was a student at GW. And after graduating with a Master of Healthcare Administration, thanks to GW, I got my dream job working at a multi-billion-dollar health system right in the office of the CEO. I got to do so many wonderful projects, from building a hospital to building new physician offices. And while doing so, I found something very interesting. Was that while most of our patients have insurance, they're also paying a lot of money out of pocket in straight up cash. So much so that in the last 10 years, our cash received had more than doubled to $200 million a year. And this is not a unique problem. This is an epidemic. Currently in this country, you have 86 million people who don't have insurance or have insurance but can't afford to use it. And while I bring this problem to the Office of Innovation, we interview 120 people. And what we found was fascinating. 7 out of 10 people said not the cost, not knowing the cost is the #1 frustration that prevents folks from getting care and hence delay care and end up in the emergency room with thousands of dollars in medical debt. This is when the light bulb came on, because while there are multiple platforms out there who make it so easy for you to book a doctor appointment, none of them actually help you pay for it. So I founded Mira. Mira is a better solution for people to access preventative and urgent care. We have a payment of $25 a month, 20 times cheaper than the cheapest health plan. You can find, book, and most importantly, pay in less than 30 seconds. And regardless of what you get, we have a copay of $99. We're currently starting with 22 most common conditions, many of which people are currently go to the emergency room for. And I'm so happy to announce we currently have 170 partner clinics across 22 states. We're able to do this by having 2 very simple but extremely strong value propositions. We make life extremely simple for the physician. We reduce the payment cycle from 24 days to 5 seconds. And by doing so, reduce the administrative overhead by about 20%. For the patient, it is predictable how many times you go into the doctor's office and have anxiety of not knowing how much it's going to cost. Right? This is the problem many people are facing today. And most importantly, you can use it with or without insurance. In only 7 months, I validated the market thesis, and I recruited a rockstar team of founders and advisors who found very successful ventures. We currently have 170 clinics. I actually just checked yesterday. We have a pipeline of 222 clinics. And we signed an exclusive partnership with the Urgent Care Association with over 3,000 clinics. As well as we were doing the direct-to-consumer, but we got approached by Mercer. They have about 115 live cover, one of the biggest benefit consulting firm in the country, as well as Cigna. They told me this may work for our population as well. And together, our North Star is $500,000 in annual recurring revenue by next year. We also received numerous awards. One of the recent one, we won the Accenture Innovation Challenge, and we were the only startup that won that have not raised a Series A. We also received numerous interview as well, offer from a world-leading incubator. Here's our team. Jim is here today. He's both an investor and an advisor. Alex recently founded EOS Health, now Livongo. They just went public about 3 months ago for $3 billion. And here's our ask. We're in discussion with 3 seed funds next year to raise our seed round of $2.5 million, and we're closing our pre-seed round in 10 days. We have about $200,000 for participation, and if it's also open enrollment season, it's also a flu season. So if you want to keep your employee happy and healthy, please come talk to me. $25 a month, extremely affordable. You don't even know it's there.